Hello and welcome to the pod. I'm Nathan Fink.
I'm Jolyn Drennan, and this is New Hampshire Family Now,
a show about building family in the Granite State. Today in the show, Children's Trust Program Specialist Karen Pellicano joins us to talk health, privilege, and identity that we later take to the streets. And then I welcome Lara Quiroga, Director of Community Integrated Health and Wellbeing at Amoskeag Health.
Top 5 things that identify me? That's tough.
I don't know. I have 3 right now. That's 3 for me.
New Hampshire Family Now is brought to you by the New Hampshire Charitable Foundation. Since 1962, the Charitable Foundation has worked hand in hand with generous and visionary citizens to maximize the power of giving and support, collaborate, and lead innovative initiatives. Initiatives like New Hampshire Tomorrow, which is focused on making sure children and families have access to education, healthcare, and career pathways to ensure every family member thrives. To learn more about New Hampshire Charitable Foundation and all their initiatives, go to www.nhcf.org. This podcast was also brought to you by Family Support New Hampshire. Family Support New Hampshire is NH's coalition of family resource centers and family strengthening programs that exist to ensure Granite State families have access to resources so both caregivers and children can succeed, because supported families are strong families. To find a family resource center near you, visit www.fsnh.org. Hey, it's Nathan, co-host of New Hampshire Family Now. I wanted to take a quick break from the show because it occurred to me the other day that I've never asked you to subscribe to this podcast. Subscribing is free, and when you do it, it helps our placement algorithms, making it that much easier for caregivers across New Hampshire to find valuable information and strategies for their families. Also, you'll be alerted when a new episode drops. And if you like this show, leaving a review helps us that much more. So go to wherever you get your podcast, type in New Hampshire Family Now, and as the kids say, smash that subscribe button. I say click it, because if you smash it, then you're going to need a new one. Thank you and enjoy today's podcast. Hello and welcome to the podcast. I'm incredibly excited because today on the show, I welcome Karen Pellicano, Children's Trust Program Specialist, who I have been avoiding for some time because I heard that you used to work in radio.
Long, long ago and far, far away. Yes, I did.
Well, Karen, welcome to the show. How are you doing? How's the family?
We are doing great. This weekend, we went up to Booth Bay to the Botanical Garden.
Oh, that's the trolls, right?
Oh, I fell in love with the trolls. And one of the highlights for me, when I used to go with my kids, it was, come on, keep up, slow down. I'm tired. I want to drink. Well, now my son is 24. And so he can keep up and he can go all day, but he's still willing to sit in the woods and take pictures with trolls. So right now I have the best of both worlds.
That's amazing. How are you doing?
I, for the first time in a long time, am happy to say that I am healthy.
Do you mind if I explore that a bit?
Well, for the past 10 years, I have been going through a myriad of different illnesses. I've been told several times to make my end-of-life plans, and just very recently, in my last doctor's appointment, all of the numbers came back good, and I'm in management, and things are right now going really well.
Oh my gosh, that's a huge life change. I mean, the implications must echo through everything you do, right? Every thought, every decision.
Everything you do, everything you eat, everything you consider, everything that becomes important. It's very huge.
We're talking about the very foundations, I think, of identity. Like for a long time, you said you've been in this process of kind of negotiating what that means. You must have then identified as not healthy. And now that this box or window has been opened or box has been lifted, I imagine this puts you in such a different place mentally.
Mentally, it's huge. I started off identifying as sick, but going to get better. I then identified as sick, always going to be sick, hopeless, no point, just sick. Then I identified as sick, making end-of-life plans. And now, through a lot of work and a lot of management and a lot of changes, I'm identifying as tentatively healthy, which is massive for me. It really is.
Is there an example of how this changes your day-to-day interaction with life, with others, with career, whatever?
I mean, self-care for me was a big deal. Self-care was, I'm going to take the day and I'm going to have a massage and gosh darn it, I deserve this. And now self-care for me is bringing people with me because we all have something. So if I'm having a bad day, maybe you're having a bad day. I'm having a bad day. I need to go for a walk and vent. Hey, do you want to go for a walk and vent with me? Let's go together. We're not alone. And I think that's the thing that came, is that we're not alone.
It makes me wonder so much about that push-pull of circumstance. And again, I keep going back to identity just because I think this is so revelatory. Like if I were to list my top 5 identifiers, I would probably go with parent, then spouse, then community member, then sibling, and then child. And I it is me trying to kind of reason with, I guess, where I'm at in life. If you had to do the same exercise, what would your top 5 identifiers be, do you think, at this time?
Right now, number 1 is healthy because I'm just excited about that. Parent has changed for me because my kids are adults now and they need me differently. So I'm less a mom and more a mom. It's a different interaction. I'm not here to tell you what to do. I'm here to celebrate what you do. And I'm here to cry with you when you do the wrong thing. But the choice is still yours because I'm not your mommy. So I would say, okay, healthy person and mom, definitely spouse. More now that the kids are grown up and I feel almost like we're newlyweds again because we're not mom and dad anymore. Now we're Steve and Karen, which is kind of fun.
Kind of sounds like a band too, just so you know.
Steve and Karen? Okay.
Steve and Karen's brass band.
I want to be the drummer in our band. Let me see, 2 more. Probably storyteller because that's something I'm trying very hard to become. And seeker. My husband always says I'm a seeker.
Seeker. Wow.
Seeker.
See, it's funny that you put that on your list because there's part of me that when I think about my list, it does seem responsibility based. Actually, no, it feels value based, like a value based proposition kind of reflects what I believe or maybe the assumptions I'm making about relationships. You know, like I list parent first, and that's based on the assumption I think that Jen needs me less than my children. And yet, when I start to think about it as value-based, that also seems a little bit ridiculous because I also start to confront what's not on there. Like we're on a podcast. I'm not listing podcaster. I'm not listing director of advancement. I didn't list healthy. And then thinking about healthy kicks me into this other order where I think about my sexual orientation, any sort of demographic information, racial information, ethnic information, which all of a sudden to my mind, it becomes indicative of privilege. That because I'm not marginalized, my identifiers are not in danger of being given to me or taken from me. And there's a luxury in the entire exercise, which is deeply unsettling. Like, in other words, I'm not running into my identifiers as obstacles in my life, liberty, or pursuit of happiness.
Going through getting healthy during a pandemic. And I have become, probably since I've been here at the Trust, I've become more aware of my racial privilege. And I've become more aware of where I fall in the order of things. You know, when I am going to the doctors, when I am in the hospital, when I am dealing with things that are really, really difficult, I'm aware now that I'm dealing with those things with privilege. I have access to medicines that I need and want. I have access to the annoying little beeper in my pocket that tells me how my body feels. I have access to all of these things. And because of that, I have come through 10 really difficult years and I have a really positive perspective. But if I didn't have those advantages, I wouldn't have made it through all of this. So I'm really deeply grateful, and I'm kind of mad that not everyone has that, because everyone should have that. The things that I needed to get through this crisis are things that everyone should have access to, and not everyone does.
So what do you do with that?
I'm doing a lot of work with storytelling and trying to hear other people's stories and give other people the opportunity to tell their story. I spout off a lot, and I'm trying to bring people along that may not have the advantage that I have.
This is an incredibly interesting conversation, Karen. I really appreciate you taking the time to have it with me, even if it was a lot of wrestling and self-reflection on my part.
Most of our conversations involve wrestling and self-reflection.
I really wish I could ask other people about what's on their list, what's on there and what's not on there and why.
Well, you're on a podcast, Nathan. Go do that.
So that's what we did. And here are a few of the responses.
All right, go ahead. Probably at the age I'm at now, I try to take care of my mother, who's 83. I think I'm a good person in terms of being empathetic towards others when they're going through challenges or struggles in their lives.
Even though my kids are grown up, probably mom is top of the list. Neighbor. I think my neighbors have supported me.
I'm a mom. I'm a mama. I'm a mama.
I'm going to ask you the question first.
I think the first one right now, where I'm at as like a college student whose future is not necessarily like here, but I'm not sure where it is. I think the one that comes to mind immediately is like perspective. And then number two, would probably be like son.
Probably daughter. I'm a sister. I'm a worker, a scholar, and a sports player.
I'm a teacher. I'm a laugher. And I'm a total spaz. The rest of the time.
And we'd love to read your list too. Send us an email at communications@nhchildrenstrust.org with the top 5 identifiers that describe you. And up next, we welcome Lara Quiroga, Director of Community Integrated Health and Wellbeing at Amoskeag Health. Don't go anywhere. Join New Hampshire Children's Trust September 22nd for the 10th Annual Strengthening Families Summit, The Power of Stories. Grounded in the Strengthening Families framework, this year's summit will examine how storytelling can empower, heal, expand perspectives, and influence decision makers to invest in New Hampshire families and build strong communities. Early bird ticket sales are available now through August 17th. To learn more, visit nhchildrenstrust.org. Many thanks to New Hampshire's Office of Social and Emotional Wellness for sponsoring this podcast. Started within New Hampshire's Department of Education, the Office of Social and Emotional Wellness consolidates policy development and implements projects and programs that are focused on health and wellness with an emphasis on behavioral health of all students, youth, and families. To learn more about the Department of Education and its many programs and approaches, visit www.education.nh.gov. This podcast was brought to you by Nixon Peabody, who delivers exceptional legal services for clients in the community by combining high performance, an entrepreneurial spirit, deep engagement, and an unwavering commitment to a culture of collaboration, diversity, and humanity. Nixon Peabody works with universities, hospitals, and nonprofits of every size to maximize impact. For more information, visit nixonpeabody.com. Hello and welcome to the podcast. Today I have the great pleasure of welcoming Lara Quiroga, Director of Community Integrated Health and Wellbeing at Amoskeag Health. Lara, welcome to the show.
Thank you for having me.
So first and foremost, I do owe you a public debt of gratitude because I know that you personally authorized my joining the trust. Any regrets on that hiring?
No. In fact, your name came up yesterday with a colleague. And I said, whenever Nathan's name comes up, I like to remind people that I was the board chair at the time. And
you probably saw me being scared and that you knew I smelled like cheese. You as the Director of Community Integrated Health and Wellbeing, when I hear that, I keep thinking that you really have to assess a community's current state. Big, broad brushstroke, because I know you're in Manchester. How's the Queen City doing and what opportunities are out there to help children and families?
There are a lot of opportunities to help children and families, especially when you look at the needs, as you just said, of Manchester, but also greater Manchester. As I'm sure you've heard over and over, the pandemic really has exacerbated some of the challenges that families have been facing, particularly in the areas of economic security, food, and housing. Certainly, there's been strides to make it better. It's still a real challenge. And now we have kiddos back in school, and we are starting to see all of the behavioral, the social emotional challenges of coming back and being with other people and not being at home and having a different routine. And some are grieving because they've lost people during the pandemic. And there's been a real wave of mental health challenges in our community that we're really struggling to build our capacity in order to address. That being said, it's an opportunity for us to think about how are we offering our programs and what are the areas that we can grow. and support our community in better ways. So we have expanded the support we are offering to the Manchester School District. We have some community health workers and behavioral health clinicians in the elementary schools. We already had some there. We also had behavioral health clinicians in middle and high schools. So we are expanding those offerings to really just help the district meet the needs of the students. That's been a huge, huge focus for us as well. We have continued to really focus on supporting people and their financial needs. And it really ranges. Some of it was with the support of local philanthropy, giving gift cards to families, like here's a gas card, here's a gift card to the grocery store, those kinds of things, and physically distributing food to the sort of other end of the spectrum around education. And how can you use the dollars you're getting from your tax return to build some savings so the next time you get a flat tire or your brakes go out, it doesn't throw your whole world upside down. So we're really trying to do both of how can we help our community respond to all these needs through immediate supports, but also let's make a plan for the future so that you can be stable and eventually thrive in the world we're living in today.
That's a really interesting way to approach support, because it almost seems like you're using intervention as an opportunity for future prevention. And when I look, this notion of community integrated and meeting folks where they're at, how does that community integrated stationing of your services change the ball game for the people that might access them?
Well, certainly it makes it a lot easier to not have to be out in public. It removes barriers for transportation. Certainly, even just telehealth has removed a big barrier for a lot of people. I mean, it can make the world of difference for a family who makes hourly wages and maybe gets very little time off, and frankly is using all their time off because their kid keeps getting sent home from school or childcare on a COVID protocol, right? So there's opportunity for them to get those other supports that they might need, let's say some behavioral health support via telehealth. And that has removed a transportation barrier. It's removed maybe a work schedule barrier. There's some real opportunity there to be a game changer. The other piece is really, sort of diving into those neighborhoods. There's a comfort for families. They know their people, they know their network. It's really one of those protective factors. They know where to go for concrete support in times of need, and they have this network of support, and that can be their neighborhood and it can be their school. So we're really trying to capitalize on those two particular protective factors.
Let's say I need a gas card. I go somewhere. I hear about this program. I go in. Does the word integrated mean that the person that's helping me in that moment will also say, hey, I noticed that you might need another service? Is that the way the integration aspect plays out in the moment?
Absolutely. Really, it's the stabilizing first. You came to me with this problem. Let's address this. Certainly if that person wants to, right, there has to be a willingness from that person if they want additional support to say, like, let's make a plan. What you mentioned, I know you're struggling with gas right now, but you said something about your heat. Can you pay your electric bill this month? Let's sit down and make a plan. Let's make sure that you're accessing all of the supports that you're eligible for before we disconnect. And certainly the staff that Amoskeag Health has out in the community are meant to be those resources, those people that are experts in the community resources. And I should say that Amoskeag Health is not doing this work in a vacuum. It truly, I was going to say it takes a village, it takes a city. We have the Manchester Health Department and the city of Manchester hiring community health workers to partner with the police to be out in the communities and the neighborhoods. We have community health workers. The New Hampshire Department of Health and Human Services is putting community health workers in family resource centers, right? It's all hands on deck. In addition to the other supports that are available, as the New Hampshire Children's Trust knows, kinship navigators in family resource centers to help relative caregivers navigate the systems of supports and services available to the children and families. So yes, it's us and we're integrating into the community, but so are a lot of other people.
It is so heartening to hear you say that because, as you said, it takes a community. Lately I've been thinking a lot about the escalation of services or the acuity of need, right? So as your challenge escalates, we are really good at referring up the chain because we're trying to end crisis. If that crisis gets bigger and bigger and bigger, at times response can come to you. The idea of referring down the chain just so we can get back to baseline, I think is one really great opportunity point. Hypothetically speaking, let's say there's a crisis in the community. What supports are available coming out of Amoskeag Health and its partners to respond to something that has escalated to that community crisis point?
Manchester, in some ways, is really blessed to have some supports. There's mental health crisis support through the mental health center. There is 211 is available to everyone. But specifically for Amoskeag Health, we've now had a partnership with the police department and the YWCA really since 2015 called the Adverse Childhood Experiences Response Team. And it officially kicked off actually in July of 2016. So we're surprisingly almost at 6 years here. But the idea is that when the police are called to some sort of situation, it could be something like domestic violence, it could be check condition of a person, really anything that police are called to, and they notice that a child lives in the home or was present for the incident, they sort of make a note of that. And the responding officer makes a note of that. And this team, again, ACERT is what we call it, will respond. And with that family's permission, they will help connect them to a resource in the community that will help mitigate the potential longer-term risks associated with adverse childhood experiences, like mental health concerns, like heart disease, there's just a really wide range. But what we want to do is get that earliest point of intervention to start helping the child and family process whatever the situation was, and again, get them the support that they need so that later on they're not dealing with more difficult challenges or poor health or behavioral outcomes.
And it seems critical to, say, a community's healing, because it's an intervention point for a family where a child is present. But we live in communities. And so I'm wondering about how a team like this is critical, or the communal response is critical to a community's healing. How do you see that playing out?
Well, I like to think it's made a difference for the 1,400 or so kiddos that we've referred to community support since we started. Those are kids that before this started program would not have had that kind of support. And I think that we're sort of living in a time where we go in waves of, pull yourself out by your bootstrap or whatever the phrase is. And then other times there's really wonderful times where people do come together for others. And we're in a tricky place right now with a pandemic. We're trying to get back and figure out how to do it safely, but we might not be doing the things that can provide that support, like going over to your neighbor's house and like bringing them some food, or just going to up to someone and giving them a hug because you know that they need it. There's these sort of things that are preventing us from feeling really connected to each other in meaningful ways. And the great thing I think about ACERT is that there is an opportunity to connect families to these other kinds of support that maybe they didn't know about, that can help them feel connected, at least to a professional, but in other cases, people like them, and connected to these people that they otherwise would never have known.
Now, with the ACERT team, that team's comprised of different segments of response. You've got a family advocate, you've got a crisis service advocate, and then you have a first responder, all of which I imagine have different point of views and perspectives on the exact same situation. And I'm wondering, why is it necessary to have those three different point of views available for, say, a wraparound response?
The three perspectives are, important from our standpoint because officers are there. They have access to the original information. They're there to make sure that the team going back out to the homes of families are safe. We are sometimes responding after, as I mentioned, like a domestic violence, or it could be a break-in, or, some sort of situation. So we want to make sure our team is safe. We have the crisis service advocate there because the number one call for service in Manchester is domestic related. And so that's a particular area of expertise that we find is really valuable. And then the community health worker, family advocate person is that community resource expert, right? Like they know the organizations in our community. That person has built relationships with the intake people in those organizations and understands their program program so that we can make the right kind of referral, but not just to like, here's their phone number, but can actually support families and say, like, with your permission, I'll call, give them your name and number. They'll call you directly. They'll do this process with you and work to get you in. But that, I digress. The team, I also think from the family's perspective is you might connect with someone over another. And I'll just give you a really quick example. One time I was out with the team. One family we saw, the person, the adult in the home, just wanted to talk to the detective that was with us. For whatever reason, that was just the connection that was made. And so the community health worker was over interacting with the child so that there wasn't any sort of re-traumatization. And it was just the affinity, it was just this affinity to these people that worked out for that family. And then, the next family we saw, the same sort of thing happened, but this time the person only wanted to talk to the community health worker, and the police officer just stepped back. And so it's really interesting to see sort of who people gravitate towards, but it's really important. Relationships are the foundation of all of this work. And certainly when you're trying to offer people support.
And I imagine, though, a police officer having these two other folks on the call is also influencing his or her reactions going forward. Are you seeing kind of a bleeding through of perspectives?
There's a few things that we've been doing with the police department. One is training tailored to law enforcement around trauma-informed responses. So when you're responding to a domestic violence incident, what's your body language around the child? Are you kneeling down to their level if they're younger? What are the things that you're saying to them? And it's significant. It's a 4-hour in-depth training with a doctor of psychology. And in addition to that, I got to say, even before we started this training, the police department, that team will do anything for kids. I mean, you say a kid needs something, they are there. It's just how they are. And honestly, I'd say the same thing, now that we've been working to build ACERT's relationship with the Manchester Fire Department and AMR, kid needs help. There's just no question.
I hear a lot about Launch Manchester, and I'd love to know a little bit more about it and how it fits into the early childhood regions that were, recently redrawn.
I love to talk about early childhood. It's sort of my life's work. And I was really lucky to be hired by Amoskeag Health back in 2013 to help lead Project Launch. And Launch stands for Linking Actions for Unmet Needs in Children's Health. Originally, it was a grant that the state of New Hampshire received from the Federal Substance Abuse Mental Health Services Administration. And Amoskeag Health was chosen as sort of the lead organization because it's a federally qualified health center and serves a larger community and could partner with other local agencies like Waypoint, Easter Seals, the Mental Health Center, the Moore Center, and many others. So that work and that grant built over 5 years, and it really focused on building those partnerships to help coordinate services for young children and families, provide certain services like developmental screening and integrating behavioral health into primary care. But the biggest piece was around system building. And what's happened over time is that things like Project Launch and this system building and collaborating across partners serving similar populations, particularly young children, they've been popping up around the state. And we had stuff pop up in Somersworth and Rochester, Nashua, Monadnock region, North Country. And New Hampshire is not alone in this. Other states are seeing early childhood and the importance of early childhood, the understanding of it increase over time, and saying, how do we set up our systems so that we're really focusing on young children and the things that families with young children need? So long story short, these coalitions have been popping up, but not every region of the state was covered. And that's problematic for some children and families that live in those regions. So these coalitions, and New Hampshire was lucky enough to get a preschool development grant through UNH and the Federal Administration for Children and Families. And so UNH, in partnership with New Hampshire Department of Health and Human Services and Department of Education, really worked together, got a lot of input from the existing coalitions and other entities about how should we set up regions in our state. And so we are respecting the various regions of our state, the resources they have, Yet creating a system that is coordinated, people know where to go, people are communicating. And so they identified 7 regions. And for Amoskeag Health, what that meant for us is we have the opportunity to build our partnerships where Launch Manchester really previously focused just on the city of Manchester. We now have the opportunity to grow, to outreach to more actually of Amoskeag Health's broader region, but also strengthen our partnerships outside of just the city of Manchester. So we are the lead entity for our region, but in partnership with the Upper Room, which is a family resource center out of Derry. So we have a large territory to cover, both the greater Manchester and the greater Derry parts of the state. But we are really excited, I think, to expand this system development across the region, take what we've learned from Manchester and apply what works in other parts of our region, and then recognize that they also have been doing some of this work and build on those strengths as well, where it's a really exciting time for early childhood in New Hampshire.
Lara, that's absolutely awesome to hear all of the work around the early childhood. I so appreciate you joining the show. Please come back because I want to hear more about the regions, more about what you're doing, ACERT team, and everything that you offer. Thanks for coming on.
Thank you for having me.
To learn more about Amoskeag Health and all their services and supports, visit www.amoskeaghealth.org. Many thanks to the Samuel P. Hunt Foundation for sponsoring this podcast. Established in 1951, Samuel P. Hunt Foundation is a Manchester-based, independent nonprofit that provides grants primarily for the arts, children and youth services, faith-based organizations, educational institutions, healthcare, and human services. Today's show was also brought to you by the Children's Hospital at Dartmouth-Hitchcock and the Child Advocacy and Protection Program, a multidisciplinary program with the Children's Hospital established to evaluate and provide integrative care to suspected victims of child maltreatment. Together, a team of physicians, advanced practice registered nurses, social workers, nurses, and child life specialists work to provide consultation and evaluations of children who are suspected victims of abuse, so to serve in the best interest of children and families at multiple levels of prevention. For more information about Children's Hospital at Dartmouth-Hitchcock and the Child Advocacy Protection Program, visit www.chadkids.org/child-advocacy. New Hampshire Family Now is listed on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, iHeartRadio, and more. Listen wherever you get your podcasts or ask your smart speaker to play New Hampshire Family Now.